Hi guys, this is Dr. Shamima Sattar from the YouTube channel Doctor to Help. Today is 4th of July, the Independence Day for America, and we are going to continue talking about migraine. What are we going to discuss today? We are going to talk about percentage statistics, triggers, prevention, and treatment of migraine. Do you know that about 33% of women and 13% of men have migraine? Do they all have the same features when they have migraine? No. Some people may have aura. They can have visual sensory aura. Some people may have just a headache with no auras. And some people can have those aura symptoms and with no headaches at all. So it's a complex process and we still are learning about it. So what do we know so far? What are the triggers of migraine? If you want to prevent migraine, you need to learn your triggers, and it's very important to learn your triggers. Everybody is different. Do you think dehydration can cause migraine? Yes, it can. One of the causes for menstrual migraine is hormones as well as dehydration because of the volume loss. So we need to drink about 8 to 12 glasses of water every day to prevent that migraine. What else? Sleep. We want to sleep about 7 to 8 hours every night. If you don't sleep enough, it can trigger migraine. If you oversleep on the weekend, you didn't sleep much over the weekdays, you slept about 3 to 4 hours and you make it up in the weekend, guess what? It can also trigger migraine. Why? Because your stress hormone level is up throughout the weekdays, and on the weekend, the stress hormone level goes down and your neurotransmitters goes up, and that triggers the migraine. So you need to try to sleep 7 to 8 hours even on the weekdays, and try to sleep about 7 to 8 hours on the weekend as well. A good routine: go to bed at the same time, waking up at the same time, no heavy meals 3 hours before you sleep. Don't do anything, only sleep and sex in bed. Okay? Nothing else. All right. What else can cause? Can strong smell cause migraine? Yes. Perfume, disinfectant when you're cleaning the house, air refreshener, if they have strong smell, it triggers my migraine. Yes, I have migraine too. And believe me, every trigger that there is, I probably have them all. They're all my triggers. So I always try to stay on top of it. And as soon as I know it is hitting me, I try to take care of it. So what else can we do? If you have anger, it causes tension in your muscles, in your back of your neck, in the shoulder, in the back area, and that can also trigger migraine. What else? Exercise. If you exercise too much, it can also trigger. Even sex, for about 5% people, sexual activity can cause migraine. But good news, it's only 5%, right? What else? If you miss a meal, it can also trigger migraine. The hunger, the stress of the hunger can trigger it. So you don't want to miss a meal. You want to eat 3 to 4 meals, whatever routine you do, the 2 big meals and the snacks, please maintain it. All right? Also, alcohol and smoking can trigger migraine. So whatever your trigger is, you want to keep a journal, a diary about your migraine, and think about what happened before you had that headache for the last 2-3 days just before the migraine hit. If you can identify your triggers, you know it's coming, you need to take care of it. So what do? We try to take Tylenol, Motrin, Aleve, ibuprofen, any of them that is handy as quickly as possible. Please remember, if you have kidney problems, ibuprofen, Motrin, these are NSAID, may not be a good idea for you. If you have liver problems, you have alcoholism, also Tylenol may not be a good idea for you. So you want to make sure you are safe in whatever medication you're taking. So if you take it in time and early enough, paracetamol, that's Tylenol. In some countries, they call it paracetamol. Tylenol, ibuprofen, Aleve, Motrin, those should all be able to stop it. So essence is time, it's speed. Take your medication as soon as possible. You will notice women, they carry those medication wherever they go in their purse. Why? Because they know they have to take it as soon as possible. One of the ways I get my headache nowadays, because if I'm working online and I have got I see a patient, I come back and I see 8 patients waiting for me in the waiting room. I panic. I get all stressed out. And then I try to clear them as soon as I can. And I come back, again, another 8 to 10 patients. This really stresses me out. If that's happened 2-3 times, I might miss a meal. And that triggers my migraine. So we have to make sure that we stop and take care of our body before we stress it out. All right? So we already talked about Tylenol, and we talked about the NSAIDs to prevent that headache as soon as it starts having that symptom. Also, let's talk about aura. What is aura? It can be visual. Remember that migraine, that slow cerebral cortex suppression that happens, it starts at the back of our head, right? And then it gradually goes to the front. So depending on where it is, that's where you have the symptoms. So if it affects and in the olfactory area, in the occipital area, that's the back of our brain, that has all the nerve supply that goes and supplies to our eyes. So guess what? We can have visual aura. What is visual aura? We can have zigzag lines, blind spot, flickering, and this blind spot can gradually increase and take up to half of your vision. And that can be very scary for someone who never had history of migraine. And they suddenly have this, they will just panic. Usually, after this aura subsides, you have the headache on the opposite side. Now, if it happens in a different area, it can also manifest as sensory symptoms like burning, tingling, numbness of your hand that can gradually go up all the way to the left side of your face. So it can even go up to your elbow and then on your face, because the same part of brain supplies this both area. So the nerves, they all converge on a nucleus. Think about it as Amazon head office. All the little workers are doing all their work and getting everything together and sending all the information to the big boss. And then big boss is circulating the instruction, right? If the little ones give the wrong information, big boss will make a mistake, right? So that's what happens. So if it happens in the motor area, you have that weakness in some part of your body, and that can look like just stroke. Somebody who never had migraine before, no history of migraine, as far as we are concerned, they have stroke until we prove otherwise. Because why? Stroke is reversible, right? So if you come to us in the ER on time, we can reverse it with treatment. On the other hand, migraine, there's no cure, but there's prevention. And we can give you medication to mitigate the pain. Now, remember trigeminal neuron is one of the biggest nerve that supplies our face. Why is it called trigeminal? Because it has 3 branches. It supplies the olfactory area, the eye area, then it's the maxillary area, and finally the mandibular area. So what happens when these are triggered? You can have the ocular aura. You can also feel pain in your oral cavity, near your teeth and your eye. So those are presentations also for migraine. So usually aura lasts about 15 minutes to 30 minutes. It should not last longer than 1 hour. If it lasts more than 1 hour, definitely time to call the ambulance, even if you have history of migraine. Another alert symptom, if you're having temperature, you have a temperature, you have confusion, you have a neck stiffness, you have a rash, this can be something else, encephalopathy, meningitis, so you also need to go to the ER immediately. If none of these are happening, it's just a simple migraine, yes, you take all your medication. If you're throwing up, you cannot keep your medication down. You need to take some antiemetics, that is some medication to prevent nausea and vomiting. If you still cannot keep that one down, then you have to use suppository. There is antiemetics that comes in suppository form, even pain medication in suppository form, and you can use that to mitigate the pain. So these are the ways you can treat. Now, if you have migraine more than 15 days a month, it is called episodic migraine. If you have it more than that, it's called chronic migraine. So about 3% of episodic migraine turns into chronic migraine every year. So if you're using more than 15 episodes pain medication for 15 episodes of migraine, you can have something called rebound headache. So overuse painkillers can also cause headache. So you have to be careful. Please see your doctor. Let him evaluate you. Make sure you keep a migraine diary so they can evaluate you and give you proper advice. And if you go through chronic migraine and if you have more than 5 big attacks in a month, you probably need to be on prophylaxis. What is prophylaxis? It's also preventive. It is preventive medication. Most commonly we use beta blocker. We can also use topiramate, Depakote, and these are newer medication. And the triptan, let's not forget triptan. Triptan is commonly used for migraine. What does it do? Remember that vasodilation that causes the headache? Triptan causes vasoconstriction. So it helps with mitigating the migraine pain. So very important that you talk to your doctor and have a full evaluation. Even if you don't have complicated migraine, you want to have at least one full evaluation to make sure nothing else is going on by your doctor. And before you take any medication, make sure you talk to your doctor, make sure you talk to your pharmacist, read everything on that side effect levels, and then decide what you're going to be safe for you to take. And please talk to your doctor in details. All right, so that's all for prevention and treatment for migraine today, and we'll see you next time next week. All right, take care, be safe wherever you are, and thank you for joining me. If you like this video, don't forget to like and subscribe and share with people who have migraine so they can also benefit from this knowledge. And if you don't like it, please leave a comment so I can improve. All right, thank you again for joining me. I'll see you next time. Love you. Bye-bye.